Awesome. I think we're ready to go. Hello, everyone, and welcome to this webinar on Can You Really Teach Pharmacology Online with Dr. Karlee Johnston. I am Deepika, Scientific Support Specialist at ADI Sydney, and I will be hosting this event. Before we begin, I want to let you know that the webinar will be recorded and shared with all the registrants. So if you do have to leave early, you won't miss out. Also, please note that today we will be trying something different in this webinar. We aim to make the session more interactive by letting the attendees speak. So we will have 2 rounds of Q&A session. And during this time, if you want to talk, please raise your hand via the Zoom toolbar, and then we can have a chat. Before I pass over to Karlee, I'd like to give a brief overview of AD Instruments. At AD Instruments, we create industry-leading software and hardware tools for life science researchers and educators. So for educators specifically, LT along with education kits is one of our extraordinary offerings. So what is LT? LT is our online learning platform with ready-to-use content for life sciences, chemistry, nursing, medical, and veterinary courses. LT is used in over 250 institutions globally and comes with over 500 interactive and fully customizable lessons and labs for active learning, whether you're teaching in the lab or remotely. In today's session, we will be focusing on pharmacology. LT's pharmacology collection comes complete with professionally designed lessons and labs exploring ligand receptor binding, dose response relationships, etc., using a variety of different tissue preparations. And the platform is completely adaptable if you want to make your own content or edit the existing ones. Even though today's webinar focuses on the online teaching without hardware, I would like to take this opportunity to introduce our brand new pharmacology kits for education. We have 2 versions, basic and advanced. Um, our basic and advanced pharmacology kits provide high quality yet economical options for student laboratories conducted isolated tissue and pharmacological experiments using PowerLab data acquisition unit. The basic unit in sorry, the basic unit has a 25 ml teaching organ bath and a teaching force transducer, whereas the advanced kit it also consists of high quality glassware and comes with the tissue organ bath chamber, 2 types of glass tissue hooks and L and triangular supports, manipulator and teaching force transducer. Now, with increased animal ethics hiccups, adapting a different approach in pharmacology teaching is of utmost importance. So we are excited to host Dr. Karlee Johnston, who's going to share her approach to crafting a vertically integrated pharmacology curriculum for the medical program, focusing on the pivotal role of online resources. So just a quick introduction before I pass it over to her. Karlee is a senior lecturer in pharmacology, responsible for the design and delivery of an innovative and comprehensive pharmacology teaching program in Australian National University School of Medicine and Psychology. Karlee was recently awarded the 2023 Vice Chancellor's Award for Teaching Excellence and has been the recipient of multiple teaching awards at the school and college level. She's a consultant critical care pharmacist with more than 15 years experience in clinical practice, which she uses to provide medical students with knowledge and skills to be safe and effective. So the stage is all yours, Karlee, and we're excited.
Thank you so much, Deepika. I'm very excited to be here. I'm just going to share my screen. Okay, so I'm really excited to be here. Thank you so much for having me. Like Deepika said, I've been a little bit cheeky and asked if we can be a bit innovative in how we deliver the webinar today. And really that's more for my benefit, maybe, than yours. And that is because one of the key things that I think really excites me about teaching is that I get to learn from people that I'm teaching to and with. And so we'll have a couple of opportunities throughout this presentation to hopefully have a little bit of conversation. Unfortunately, the webinar platform doesn't let us do that as organically as what it might if we were sort of in a meeting setting, but we're going to try really hard. And so I'm going to really hope that you can really sort of humor me and engage in some of the content. So I think really to start with, I guess the teacher in me really wants to use learning outcomes. But today I thought rather than learning outcomes, we might just kind of cover off a few key moments in the presentation that are sort of the big hitters for me. And so what I really want to get across and share is how we are using online resources to really sort of bolster pharmacology learning in the medical program, and how a combination of online and workshop style teaching across the 4 years of the medical program sort of integrates to build skills as the students progress through the years. I would really like to explore some of the challenges of delivering a comprehensive pharmacology program, and I think it would be really nice if we could talk with each other about how other people are doing that and have an opportunity to share our own experiences and how we can be innovative in our teaching. So to start with, I think it's probably important to give you a little bit of context about how I've come into this position. So I am fairly new to education in a formal sense. I've been a clinical pharmacist, mostly in ICU for almost 20 years. And my motivation for teaching really is about safe prescribing in the clinical environment. In 2018, I stopped clinical practice. I actually had burnout and took 6 months off from my clinical practice and started to do some research. And at that time, the director of the medical program asked me to do a pharmacology curriculum review. And I'm going to talk to you a little bit about that in a little bit to sort of set the scene as well. I guess one of the things that is important, I think, is that I am a pharmacist and not a doctor. And I really want to talk a little bit about, as I go, how that has really influenced the way I teach and what I teach. Something that's really important to me in terms of teaching is that I like to create, or I hope to create, an environment that is very safe for the students to practice and fail. And that is very authentic, so that there is a lot of vulnerability in the room when I'm with the students. And maybe it's not necessarily in the room, but certainly whenever I'm teaching. I think one of the big things that's changed for all of us, definitely, over the past few years is, of course, this kind of quick adaptation to online or hybrid teaching. And that was a real struggle for me because I really do get energy from people in the room. And so having some online content that I had already developed for pharmacology was a really lovely platform for me to sort of jump off and really explore a little bit more during that time. And so we've sort of kept that fairly sort of kept going, basically. Okay, so a little bit about the medical program that I teach into, just for context. So we have a Doctor of Medicine Surgery, a postgraduate full-time 4-year degree. It's sort of split into two, the pre-clinical phase, or phase 1, we call it, which is delivered at our Acton campus, which is absolutely glorious. I'll show you some pictures in a little while, but it's a very, very beautiful campus. And the second phase, or the second or last 2 years of the students' experience, is immersive placement experiences. So any teaching that they have, and they do have a day of sort of teaching during those 2 years, a day a week. Any teaching that's done, we do here on site. So I'm at the hospital campus. And I guess just for clarity, phase 1, year 1 and 2 is kind of where we do our basic sciences teaching. We have a sort of core academic group that does most of the teaching. We have about 120 students, that's growing per year group, and the students are on site at the university a majority of the time. In our phase 2 group, which is a little bit less, I guess, structured in terms of delivery of education, but this is where we mostly focus on application of content. We have mostly clinicians do a majority of the teaching, a smaller group of core academics, but a lot of clinicians. And our class sizes vary. And that is because we have our students at various placement sites. Some of them are not even in Canberra. Some of them are in our rural sites. Some of them are in Sydney. And so we've, it can depend on who's in the room and what size you're teaching to. And because they're not all in one place, this is why we do still sort of keep our sort of hybrid teaching as an option for students, which has its own challenges, which of course we can talk more about. Now, so as I said, in 2018, I was asked to do a pharmacology curriculum review. And so I basically spent 6 months or so going through all of the content that was available to the medical students in their curriculum that was about medicines. And as you can imagine, there was heaps, there's lots, obviously, but actually almost none of it was labeled as pharmacology specifically. And a lot of it was delivered as part of other teaching. So as part of physiology, etc. And we didn't have really any structured or deliberate practical prescribing opportunities. And for me, that is a really big part of having safe, effective prescribers when the students graduate. So we made a bit of a plan. I wrote a report, obviously, and made a plan to develop a comprehensive pharmacology curriculum, told the university they need somebody to be able to provide structured pharmacology, and applied for that job, and hence here I am. I really went sort of from what I thought good intern doctors look like, and came backwards in terms of what they needed to know. So sort of use graduate attribute statements and my practical experience to sort of decide what good prescribers look like on the other end. And really with a focus on practical prescribing opportunities to support confidence and competence. We don't have a pharmacy school at our university, but we have a pharmacy school at the other major university in Canberra, University of Canberra. And I was very fortunate to have some very generous School of Pharmacy academic colleagues that really helped support me to develop content at the beginning. Unfortunately, as many of you will know, curriculums are very full. And so when you are writing or developing new curriculum, it's really tricky to find space for it. And so that was the forcing function that made us have to think differently about how we were going to deliver this content. And because it was only me, I'm the only one who sort of exclusively teaches pharmacology in the school. I didn't really have capacity to teach it all face-to-face in didactic lecture style. So we also had to find different opportunities in the teaching that was already being delivered to really focus or integrate some pharmacology in there. One of the big moves for me was just to label pharmacology as pharmacology. So wherever it was being taught, to tell the students, this is pharmacology, here's what you're reading. And to get feedback and constantly review how we were going. And what we wanted and what the students wanted and how they felt about what was being delivered. All right, so this is our first stop, a first opportunity for you to be able to ask me any questions, talk about what your context is compared to the context I've just described. This is our beautiful School of Medicine in the Florey building at our Acton ANU campus. So please, if you raise your hand, then we can unmute you and you'll be able to speak to me. Or speak to us all, not just to me, speak to everyone. Is this a similar sort of style to what other people are used to in terms of structure of their programs?
Can you
Hi,
hear me?
Andrew. Yes, we can hear you. Thank you for
Hi, thank you
raising
for
your hand.
speaking.
Yeah, well, I thought I'd start. I'm Andrew Somergy from Adelaide.
Nice to see you, meet you.
Yeah.
I know it's hard in this platform, isn't it? Whatever we're doing here.
So we have about half a dozen academic staff. Well, sorry. So we teach just not medicine, but dental, physio, nursing. Must be something else. I can't remember.
Another one.
So for medicine, basically, there are about 2 of us that teach in the medicine program. And of course, it's changed and it's changing now, so it's a bit tricky, but it's sort of similar. And the 2 academic staff, both of us are professors. I mean, we have quite a detailed background knowledge in all the areas of pharmacology, so it isn't as difficult. I'm a pharmacist as well, and the other one's a clinician. It isn't as difficult a situation as perhaps you being a pharmacist coming in sort of all fresh. So there's no pracs involved. And we start off, I think we now start off in year 1. Basically it goes from year 1 to year 5. It's a bit higgledy-piggledy at the moment because they're restructuring it all and doing some stuff. But I've always been of the opinion, in terms of pharmacology, we used to teach it as a block in 3rd year, all the basic stuff, and get it all out of the way, because pharmacology, as you'd appreciate, is a continuum. We talk about, well, once we take a medicine, where the hell does it go? How's it get in? How's it get out? Where in the body does it go? So and then what does it do therapeutically and all that sort of stuff. So we like to have it as a continuing, like it was a block of 10 weeks of about 2 lectures a week and one workshop sort of thing. And wow, there weren't any deaths involved, so I think that was good. It now tends to be spread over a couple of years. So saying, like last semester, I said, well, remember that lecture I gave you last year in 2nd year on the 15th of September? Well, we're going to move on from there and delve into this area. So that's my little beef with the current model in Adelaide. So I'll probably get sacked now, but anyway.
No, thanks. Thank you, Andrew. Thank you for sharing. I'll show you in a minute. Just after this, actually, I'll walk you through where the pharmacology is, because I've got a really sort of similar situation in that I agree, it's spread across. It's fairly hard to work out exactly where it goes. It doesn't go in one big block, but trying to keep them remembering where things are up to can be tricky. So yeah, thank you. Thank you for sharing. That was really good. Does anybody else want to share their sort of experiences?
Yes, we have another person. I'm just bringing them in.
Thanks.
Hello, am I unmuted now?
You are. Thanks, Liz. Hi.
Hi, yeah, Liz Tudor from Melbourne. I'm probably a bit of an outlier in that I teach into the veterinary program, the DVM in Melbourne. In fact, I was the lead curriculum designer for that program. Basically, we have a 4-year program. It's fully integrated, so pharmacology is integrated. We teach by body system, and so, for example, Andrew just talking about pharmacokinetics, we would deal with the pharmacokinetics with pharmacokinetics principles in a subject that's called veterinary biosciences metabolism, because it's an obvious place where the ins and outs of drugs would, but we also mention drugs in veterinary biosciences digestion in terms of absorption and first pass effect and so on. So it's a fully integrated program, I guess. And then I guess we have a slight concern over what then happens in third year when they go to what we call a presentation approach, which is, you know, lameness or, you know, coughing or whatever the particular presentation is. I guess my question to you is, it's, you know, we talk about the crowded curriculum and we're all very familiar with, you know, the challenge that provides. And my question, and it's possibly not for answering now, but perhaps later in the presentation, is around what is, you know, how do you address the challenge of we develop online resources and we're actually just shifting the load to the student in terms of, well, now you can do all of this online. We don't have time in the timetable for a didactic lecture, but we've just given you a 1-hour exercise online, which is on top of what you were previously doing. So how do you address that challenge? That's probably something you were going to address later anyway.
Yes and no, Liz. I was going to talk about it. I don't know that we've got a perfect answer, but yes, I will show you how we've integrated it to this point. Whether it's good or not, I don't know that we've got it perfect, but I'll share with you what we have done. Absolutely. Anyone else, Deepika, or are we good to go?
We are good to proceed, but dear audience, if at any point you do want to ask and are scared to raise your hand, you can also use the Q&A toolbar. And during your second session, I'll maybe read it out and then Karlee is more than happy to answer.
Absolutely. Yep. And just, raise your hand as we go and we can get to you when we got a sec. Thank you. Thank you both, Liz, and why can't I remember? Andrew, thank you. Gosh, my brain just stopped for a second. Sorry. Thank you, Liz and Andrew, for talking. Sorry, there's renovations here. I hope that noise isn't too loud in the background. Okay, so yeah, let me share with you what we actually sort of did and where we sort of got to. So we have a similar sort of approach to what Liz and even Andrew was talking about. So in year 1 and 2, we do systems blocks. So year 1, we do cardiovascular, respiratory, renal, endocrine, and then year 2, we do neuro, musculoskeletal, gastrointestinal, and then immunology, ID, etc. So we do blocks like that as well. And pharmacology is integrated across those blocks, and the content is separated into those blocks. In our block 1 is sort of, I guess, the foundations of sciences. And so this is where our pharmacology, our pharmacokinetics, pharmacodynamics, pharmacogenomics modules go. They go in here. One of the things that we have done to address some of this curriculum crowding is we have changed some of our, say, anatomy is one of the examples. We've changed one of our anatomy pracs is now an integrated prac. So it includes pharmacology in there, and there's an opportunity for students to, we basically do games, really, mostly, sort of Jeopardy and other games, and we do practical case-based discussion in those times. And myself and usually a clinician will come and we'll myself, the anatomist, the physiologist in the one I'm thinking about now, an anaesthetist and myself will come and we'll do some case-based discussion, bringing all of the concepts from the prac that they've done that day into a session at the end. Year 1 and 2, the students have minimal lectures from me. And what we've done is decided that there were probably a couple of little lectures throughout the block that were very just ad hoc. So there was one on antihypertensives, for example, but none on antiarrhythmics or diuretics or any of the other agents. And so instead of having that 1 hour of lecture, we have said to the students, here are the online modules, and they are there instead. I'm just trying to think what else for year 1 and 2. That's probably it. And I'll talk you through some specific examples as I go through as well. Now, year 3, which is our first clinical year, the year 3 students have some online modules, much more practical, so much more around prescribing practice. We have every student in 3rd year has a compulsory small group prescribing tutorial with me. And then we also do some larger groups, non-compulsory prescribing workshops as well. And then in year 4, we're very heavily focused on prescribing workshops, practical case-based discussion that is usually led by me and some clinicians based on whatever it is that we want to teach. One of the big parts for me in terms of the pharmacology curriculum was really making sure that we were assessing it. And as part of that curriculum review, I went through and made some recommendations around assessment. So we were not routinely assessing pharmacology in all of our years specifically. So now we do. Every year group, there's at least some pharmacology in every exam they have. There's very specific, for me, there's very specific outcomes for year 1 and 2 that are the same and consistent across the topics that they're learning, the pharmacology that they're learning. And that is that they learn by class, and there's sort of, you know, a couple of things that they must know. One of the other things that's really important to me as we're teaching is to teach the students how to use resources to prescribe safely. And so that is integrated into those modules and into those practical prescribing workshops as well. All of the prescribing modules have assessment or have, you know, quizzes or other in them. They've all got instant feedback because I don't want to have to mark them separately. And then in year 3 and 4, we include prescribing in our OSCEs so that they have to demonstrate the practical aspects of prescribing in an assessment situation, as well as some knowledge-based content in their written exams. All right, so I'm just going to fairly quickly run you through I guess the different years and what they do. So one of the pieces of feedback that the students gave me, so when I've been doing iteration after iteration of my online content based on lots of feedback from the students. One of the things they told me right at the beginning is it's too dense. And that I think is because I wrote it as a pharmacist and I thought everything was really important. So it's taken me many years to kind of take a much more trying to really decide what's important and be really deliberate about what goes in them and try and shorten those modules down to make it sort of bang for buck. And one of the things they told me was it's really hard to learn pharmacology, you know, Karlee, and we'd like you to lecture us more. And while I can't do that, I just don't physically have time. There's no time in the timetable and there's no time just generally. What I have done is create a couple of short videos. So I now have a YouTube channel called Karlee's Farm where I kind of house all my videos so the students can access them even if they're not in the online module. But I've linked them into each of my modules where I give a very rough and authentic, I think is what I'm calling it to make myself feel better, video where it's essentially, I'll show you a little bit of a clip of one if you want in a little bit, but where it's just me in front of my whiteboard teaching what I think is important and trying to unpack some of the more complex processes and explanations for them. So there's videos in those and the students have given me lots of really positive feedback that that's a really helpful thing. We've designed some online practical integrated pracs for the students that we run that sort of you might have. So this one in our block 1 is pharmacology, microbiology, biochem, path, genetics and hematology, and it's based around a patient and we follow the patient through their journey and they sort of, the students can sit in the virtual library on this site and then we take them to different labs where they can explore different things, for example. Year 2 is fairly similar, or you can see, sorry, I'll just float back to that page. Sorry. So year 1, there's, you know, this many online modules. Year 2, there's a lot more online modules. when I release the online modules, I release all of the content to all of the students so that when they're feeling like they're learning something else and they can't remember what it was about pharmacology, you know, what did I hear about anticoagulants when I was learning them in block 2, they can go back and have another look in there. There's a couple of in-person lectures, but similar, we've moved to sort of integrated pracs and making space in the timetable for pharmacology to go with other content. And we, towards the end of year 2, we have our block 7, which is our sort of pre-clinical block to sort of get them ready for the clinical environment. And here we do a practical module with some online, an online module with some in-person prescribing around that, with a focus on safety or medication safety. Year 3, there's a lot less online content, but there are just a few. We do small pediatric prescribing workshops with a group of like no more than 8 at a time. I run those every 2 weeks, and every student has to do one. They're compulsory and it's part of their portfolio. They have to submit a pediatric inpatient chart, a pediatric fluid chart, and a PBS prescription. There's a video that goes with that lecture so that I don't have to do don't have to do any content. We just kind of get straight into the practical side of it. We don't have a lot of time. Every single student gets feedback on their prescription so that they can pass an exam, essentially. We also do some large group workshops, and the national prescribing curriculum modules are compulsory, and they are linked to our case-based learning sessions. So all of our year 3s are in small groups for case-based learning. And I have said, for this case, here's the NPC module you need to do as part of that CBL. And then in year 3, this is where we do most of our practical prescribing. This is run as a hybrid every Friday. Every Friday for an hour and a half, the students have me and we do prescribing practice. Case-based prescribing practice, myself and a clinician usually, depending on the topic, will just basically go through cases with the students. The other thing that we've done in year 4 is give our year 4 students a P list, or a prescribing preference list that I've come up with. It's about 40 medications that they have to know by name, by route, by dose, and have a bit of a sense about what to do if the patient has renal impairment or any organ dysfunction. And that is very deliberately done, because my general advice about pharmacology and prescribing is that you probably shouldn't try to remember doses of drugs. You should know where to look them up, how to find them, and how to use them practically for your patients. But there are some drugs when you're an intern that you either have to know really quickly because it's an emergency situation. So all the ALS drugs are on that list, or is a drug that you're going to prescribe just a lot of. So paracetamol, ibuprofen, oxycodone, morphine, enoxaparin, those kinds of things are on that list, and they can be assessed on the specifics of those drugs. So we're very clear about what is accessible and not accessible in terms of pharmacology for the students. So it's very clear to them what we want to get from them. All right, I know that was really quick, but I want to give you an opportunity to talk to me about what you're doing, and I'd love to hear your thoughts and feedback about what you think we can do differently or hear more about.
While the audience is thinking if to raise their hand or put the question in Q&A, dear audience, I would quickly like to just launch a poll. If you want to know more about LT platform or want to get in touch with Karlee, please answer this and then we can get back to you. And now I do have Andrew who wants to talk to you, and
Fantastic.
I'm bringing him forward. Andrew, you can unmute yourself and have a chat. Yeah.
Sorry, Karlee, you probably answered these 2 questions about, you talked initially about practical prescribing. So my question had been, do they write a prescription? But I gather they do in year 4.
Yeah, they do. This is a really interesting question, Andrew. They do lots in year 4. We do it every week. They write a prescription. what is really interesting is we have here in Canberra, we've just gone live with our digital health record, which is a fully integrated digital system, including prescribing. One of the challenges about prescribing practice now, of course, is the students come to me and they say, why are you getting us to practice on a drug chart when we're going to be using a computer in real life? So actually what we've started doing is we don't have a way for the students to access that system off-site at the moment. They can access it on-site, and we teach them how to use it and how to prescribe in the system to then get signed off by an intern or another doctor in the clinical environment. But I have access to that system, and so any practice prescribing we do, I get them to do on drug charts, and then I will do on the system so that they can see how that would look when they're prescribing electronically. But I like to tell the students the practice of prescribing is not writing down. Writing down is the mode to communicate your decision. The whole process before about deciding what and how much and how to give, doesn't matter what the platform is that you use to actually write that down at the end. That whole prescribing cascade is really important, no matter what that end product is. So yes, they do.
What about a PBS script in the very...
Yes.
Yeah, okay.
Yep. So they do, we do PBS prescribing in year 3 with our small pediatric workshop. And then in year 4, depending on the case, we'll get them to write some PBS scripts on discharge for our patients.
Yeah. And my second question I'd written down about drug names, because that's one of the horrors that all students approach pharmacology. You know, got 3,000 drug names to deal with, and I noticed in year 4 you had your top 40 or something like that, which I thought was quite a good approach.
Yeah. So the way I teach them is you have to be able to, from year 1, you have to learn by class. You have to know the class, and you have to be able to list at least one drug in that class. I can't assess you and say, this patient's on perindopril, what is it? But I can assess you on this patient's on an ACE inhibitor, what's its mechanism of action, and name one. So I teach them that, you don't have to know the names. But yes, in year 4, we have a list where you actually do have to know the names of these 40 drugs and the doses, and they're accessible.
And when they write a script, doesn't matter how, have you followed it up with patient counselling?
It depends on the topic, but yes. So generally, depending on what case we're doing, we'll have one where you also have to counsel, say, the parents on how to administer or how do you draw up this amoxicillin dose in this thing. What are the key counselling points for the patient on this drug? What do you know about it? And what is important for the patient to know about it? So yes, but I would say we're not great at assessing that, if I'm honest, Andrew.
Yeah, that's good.
Any more questions from the audience? You're welcome to type in the Q&A toolbar, or just raise your hand as usual. So we do have one question that came through, Karlee.
Right.
You've been mentioning block 1, block 2. So is that something similar to a semester, or does it work differently for you?
No, like we've got a really annoying program that's kind of outside of all the usual university structures. So the block is a systems block. Its duration varies. So block 4 for us, for example, is very, very long. It's a very heavy, content-heavy block. It's neurology and musculoskeletal. And it goes for like 10 weeks or something really, really long. And then block 5, which is gastro, goes for like 4 weeks. It's very confusing for the students and for the academics as well. But it's kind of just, we've just always, I don't know, just always had it. So yeah, sorry, it's funny how quickly you just use your own university language, isn't it? You forget that other people don't know what that means, or the content of which that exists.
Sure. We do have one raised hand here.
Right.
And I'm bringing Maja in.
It's Maya. Sorry.
Maya, sorry.
That's okay. Funny spelling. I teach pharmacology for paramedics in Victoria University, and asking about block is something we do also, but our block is 4 weeks for any subject, and I teach a first year pharmacology for paramedics in 4 weeks. So there is one extra challenge on the top on the heavy content. So my question is if you could clarify what your online modules contain. Is that the reiterating important content, or it is like a set of the exercises, the worksheets, or something similar?
Yeah, thank you, Maya. I will show you some. I'm going to show you a couple of my online modules. They vary depending on which group I'm targeting. So like my year 1 and 2s is kind of basic content knowledge. I have, again, based on student feedback, now I've started to integrate some cases for them so they can actually start thinking about application, but to keep it really simple, and I'll show you a look. Whereas in my third years don't have any. My third year online ones are really just opportunities for them to practice prescribing and then have that checked against a model answer, basically. But I'll show you in a minute. I'll swap screens and I'll show you a couple so you can have a look.
Thank you.
So before Karlee shows the screen, does anyone have any more questions? As usual, feel free to type in the Q&A toolbar or raise your hand.
Deepika, can I just check with you? I'm really sorry. Is that noise awful for you? Can you hear that enormous?
Not at all.
Okay,
it's just
good.
you.
It's very loud here, so I just really hoped it wasn't. That's fine. I can block it out, but I just wanted to make sure everyone else wasn't.
No, all of us are hearing the content of your presentation.
Thank you. Perfect.
While we are waiting, I do have a question I want to ask. So how has LT platform, the Cura Cloud platform, helped you make it easier for students to make this flipped classroom approach more successful?
So I'll show you a little bit in a minute, but for me, what it does now that I've it's taken a little while to work out where to pitch it and how to do it well. And I think, again, because I wanted to deliver so much content, I was really fixed on there just being so much content in there, but I've really peeled that back. And so what it is for me, it is one place where the students can go and they can access everything. So they can find the video of me in there. They can find a chart to practice on. They can do some cases in there. They can do exam practice in there. So there's lots of quizzes in all of them. So what it is a space where they can really, everything pharmacology related, especially in year 1 and 2, they can find there and use it. And I assess based on that content, the assessment, and they know this, and assessment drives learning. So they know that that what is in those Cura Clouds will be accessible in the exams.
Sure. I mean, I'm sure when you do show the courses, we'll have more questions. So without further ado, let's get through it.
Perfect. So I guess just really quickly, I guess one of the things that I think has been really valuable for me is that because there wasn't really a sort of structured pharmacology program before. So I've written it and designed it and teach it, and the students see me all the way through from year 1 to year 4. So I think for me, that's really nice. I'm sort of the face of pharmacology. So students see me, they know what I'm coming to teach them. But it has also meant that I have been able to, over the last 5 years, see the difference in the confidence and knowledge that the 4th year students have compared to 5 years ago, 4th year students. And so that has been really valuable because I know that their content knowledge is just a lot higher now. And I'm actually having to change my year 4 teaching to make the cases more complex to meet those needs And so that's actually that's wonderful. It's not very objective, but I have found that a really helpful process to sort of understand what's happened. We do sort of standard student evaluations, which, 8 people fill in out of 100, and I find that very frustrating. I ask for feedback on all of the Cura clouds and have a look at the student feedback following that. When I present in person to the students, I have a QR code at the end of all of my lectures that has the same feedback, so they can provide feedback after class. I have seen that sort of anecdotal change over the years. I have a open feedback policy. So I say to the students, you can email me if something's tricky and you want to understand something, or I haven't done a good job of explaining it, or the Cura cloud's wrong, which is one of the students emailed me the other day. She said, you've got the answer wrong, and she was absolutely right. I did. And I've also used the AMA intern preparedness survey to show that our prescribing confidence of our interns in Canberra has increased over the last, well, when they last did it, I think it was just a bit pre-COVID, but it had increased over the 2 years prior. So I'm very interested in the student feedback, and maybe a little bit too reactive to it, but it has absolutely improved the quality of those online modules, and they're much more fit for purpose now than they were before. So it's been really good, and they're a lot shorter now than they were before, so the students appreciate that too. All right, so I'm just going to stop sharing, and I'll head over to my modules to show you a look at them. I've kind of picked 3 that are, I guess, a little bit different from each other to show you the difference. Just to check, Deepika, can you see my screen?
Yes, I can
great.
see.
You're happy. Okay. So this module is for our one of our block 4 topics. This one's analgesia specifically. And you can see that at the top, there's that same learning objectives list is the same for all of my modules, so that they know every single time that's the expectation for pharmacology in year 1 and 2. I'll show you a little bit of this, if you can, just so that, I don't know if you'll be able to hear it based on what I've got, but this is my
Hello again, and welcome back to Karlee's Farm. Today we're going to talk about analgesics or painkillers. I'm going to only really cover nociceptive pain. We're not going to talk about neuropathic pain.
So, I mean, I'm not going to make you listen to my analgesia video, but this is just to show how basic these videos are. They are very low quality in terms of their sort of media quality, but the students have basically said, we just really like that what we see is you teaching us the way you would normally teach. So that's the video that sits in there. There's a table here for the students to describe these different types of pain. The WHO analgesic ladder, little overview of the classes, and then some questions to sort of see where they're at. An opportunity for them to type in some of the adverse effects associated, little picture of the triple whammy, and then again an opportunity for them to write in some of their some examples of some of those drugs. And then there's a case in here, and this is an opportunity for the students where I like to get them to practice using the therapeutic guidelines and the AMH, just to work through some basic pharmacology stuff. So I've said in this case, this is a young lady who's fallen over and hurt her wrist, nothing serious on imaging, and no past medical history of relevance, and she's 70 kilos. And so I've said that the GP wants simple analgesia and has decided for paracetamol and a non-steroidal, and then I'm asking them to go to the AMH and the therapeutic guidelines and choose a drug and choose a dose and choose a duration. And then there are answers in those model answers in these boxes so that they can check their answers. And then it kind of progresses as you go along. Yeah, that's kind of it. There's just, a few different ones, and then there's some other cases in there as well. And then at the end, there's a multiple choice question. So that's kind of the basic, like year 1, 2, that's sort of what the modules look like. And then And then, of course, that's expired because I've been sitting here talking to you. And then in block 7, which is our sort of pre-clinical block, this is a prescribing readiness module. So they have to do the NPC online modules and they have to upload their completion certificate so that I know that they've done that. And then that's all of them. And then, so then there's prescribing on, this is one of our hospital's intravenous fluid chart and how do you prescribe. And then here's an example of mine, and I need you to choose which one of these is maintenance versus resus versus whatever, label the thingo, and then please prescribe it, annotate the chart, and put the right thing in the right section. And similarly with the national inpatient chart, they can come here and they can find it here and download it. And then I ask them to prescribe. There's a pediatric chart, there's a PBS, exactly the same process. So that's kind of the end of year 2 when we're getting them ready for year 3. And then in year 3, we used to have a face-to-face pediatric fluid prescribing lecture. The lecturer went on maternity leave, and so we've changed it into an online module and are working. We have a workshop, a pediatric prescribing workshop at the beginning of their pediatric term, where we do prescribing fluids and then also growth charts and some other pediatric things that I run with a couple of the pediatricians. And there's some throughout here, just some, opportunities for them to think and write in what they think is going on. There's a link here to our prescribing guideline that we use here at Canberra Hospital. Some specific information about the shock maintenance, rehydration, etc. What a fluid chart will look like, and then have a go at filling in how much fluid you think these different weights of children will need. Which of these fluids would you use for which context? Some oral rehydration, and then just a bit of a quick, here's the crux of what we want you to know at the end, and some cases to work through what the child will need and then actually prescribe it on the charts. And there's quite a few of those and some multiple choice questions at the end. And that's pretty much it. Happy to share more if you want to see more or whatever, but we're pretty short on time, so I don't want to take up much more time. So I guess if there's any questions, ideas. This is so cute, this picture of this guy like with his head in his hands about pharmacology, but it bothers me. I don't know if you've noticed, but there's a spelling mistake and it just really bothers me. I just found it this morning and went, oh, golly. So any, I guess, final comments, questions?
Sure. I mean, I'll just add a final question to just wrap up the whole presentation. So it looks like a lot of work went into making these classes, and I'm really impressed with what you've showed us today. I hope the audience learned from it too. So has it made, how has the students' feedback been after you started this?
Initially, the students were very grateful because they'd sort of gone through without any pharmacology. Now the students are less grateful because this is sort of expected, which is great because they expect this as part of their learning. But I think the one thing that I would say is the students do think that pharmacology is tricky to learn. I teach them how to learn it. There's a video and a Cure Cloud on how to learn pharmacology as well. But I think they appreciate, they can see how it all links together across the 4 years, and they can see that it grows and it's leading to practical prescribing. So for me, some of it is just about the transparency of where pharmacology is and why it's important and how it goes across the 4 years, and that we assess it. And the feedback as interns or as they move into their, post-university lives is that we do a lot of practice with them and they feel very prepared for practice.
How many percentage of students get those case studies wrong? This is just a very curious question.
Look, not many. They're
Yeah,
actually,
that's good.
yeah, they're kind of straightforward. They're not supposed to be really tricky. We're just sort of trying to get general content. And the other thing that's really important to me is to build their confidence with prescribing. So I don't want to make them so hard that they don't get them right. That's not the point. So they're actually very few get them wrong.
That's good. And yeah, thank
It's
you
all sort of
so
formative to get them to where they need to go.
Thank you so much, Karlee, for sharing your experience here today. And to the audience, you actually have been a great audience.
Wonderful.
Yes, and thank you for asking your questions, sending questions in. And if you do have any questions for us, AD Instruments, you can reach out to my colleague Parimal or me for support, Deepika here. And it was great hosting all of you. And you, Karlee, thank you again.
Thank you. And thank you for being brave and letting me do something a little different. And if anyone wants to get in touch, please do. You can contact me through the ANU. You'll find me on the website, but it's just my name, karlee.johnston@anu.edu.au. Please feel free to email. Happy to share anything I have with anyone.
Awesome. Again, thank you, everyone. Have a good day.
Thank you.